Men by the time they hit 55 years old, and it only worsens with age. Rachel McNeil has information on a non-invasive medical device that can bring rapid relief to men who desperately need it.
I was probably around 45 that I noticed, and would have to get up more frequent at night to urinate.
Gary Baker is a rancher who spends most of his days out on a tractor, days and nights that were interrupted by the need to go to the bathroom, sometimes every half hour.
You're exhausted because you haven't had the amount of sleep that you need. And then anxiety sets in, you're just irritable through the day, so there are a lot of side effects.
Gary is one of nearly 40 million American men who suffer from an enlarged prostate.
BPH, or benign prostatic hyperplasia, is really the physical enlargement of that glandular tissue of the prostate. And the incidence of that enlargement causing symptoms and happening increases each decade of life.
Symptoms include urgency to urinate, difficulties urinating, impaired sexual functioning, and fatigue.
Hey, Gary.
If left untreated, it could cause permanent kidney or bladder damage. At one point, Gary was on medication for BPH and anxiety.
When you get to a point, you realize that you'll do anything.
So what really interested me was that it was a totally different treatment than what we'd had before.
UroLift is an FDA-approved outpatient, minimally invasive procedure that uses tiny implants to relieve obstruction of the prostate with no cutting, heating, or removal of the tissue as with previous treatments.
It's literally like holding the lobes of the prostate open, just like opening the curtains on center stage.
Newly released 5-year clinical trial results show the UroLift symptom is the only BPA procedure that does not cause new symptoms of sexual dysfunction. Doctors say it is a permanent solution that should become standard care. Gary says he's totally off his medication and he's sleeping soundly now.
I feel great. I feel great. It's just a new lease on life. It's really been a life-changing procedure for myself.